Hi everybody, my name is Dr. Aaron Baxter. I'm with Synergy Radiology Associates and primarily work at Memorial Hermann Katy. Pelvic congestion syndrome is a syndrome in women that is caused by dilated veins. So the symptoms would present in the pelvis and in the legs as chronic throbbing pain that is typically worse towards the end of the day. And it's something that's been going on for at least 6 months. It's something that you would see your gynecologist and work up other pelvic causes of pain, and if those don't reveal any causes of pain, then pelvic congestion syndrome caused by dilated veins is something to consider. So women of reproductive age have higher risks of this syndrome because estrogen is a vasodilator. So it is related to the level of estrogen in your body. There are drugs that you can use to help with it, but they do have side effects as hormonal medications do have. So if that doesn't help enough, then something to consider would be an embolization / sclerosant procedure. So the typical symptoms of pelvic congestion syndrome is a dull, aching pain in the pelvis and the upper legs, worse more towards the end of the day. You can have also pain associated with sex in up to 70% of women, but generally, women that have to do a lot of standing throughout the day and finding that this chronic throbbing pain in the pelvis is worse towards the end of the day, and that lying flat helps. These are signs that you should consider further evaluation for pelvic congestion syndrome. Pelvic congestion syndrome is difficult to diagnose because a lot of things can cause pelvic pain. So you really want to go through a thorough workup with your gynecologist to rule out other causes such as adenomyosis, uterine fibroids, endometriosis, etc. We get imaging studies, and when everything else is excluded, then we start thinking of something like pelvic congestion syndrome. So typically not before menopause, because it is related to the estrogen levels, because estrogen is a vasodilator. It's going to be several years before it goes away on its own. So it's something that, if this is significantly affecting your quality of life, you may want to consider an intervention such as a venogram to evaluate the ovarian veins and also the internal iliac veins. So the treatment option that we offer is something called a venogram with embolization, possible sclerotherapy. So we're able to go in through the vein either in your hip or in your neck and select the veins that are going down into the pelvis. And typically these veins are incompetent in the patients that are having the syndrome, meaning that the blood, although it's supposed to flow one way back to the heart, is pooling in the pelvis, and the veins become dilated, and that leads to the chronic throbbing pain. So we can select these veins, we can block them off with coils, we can scar them down with sclerosants, like something to irritate the inside of the veins. And so there's the ovarian veins that come down from above, and then there's the other lower veins called the internal iliac veins, and we really want to interrogate these veins and see if they contribute as well. And we may or may not do this all in one setting because it is such a lengthy procedure if we do everything at once, both the ovarian and the internal iliac veins. So it may be staged where we do one set of veins in one setting and then bring you back for another set. So this is what we can offer. There are other surgical options which your surgeon can talk to you about. Ours is great because it has a very quick recovery time. It's not a big surgery. You do have the possibility of getting pregnant afterwards because there is no hysterectomy. So it's something to consider regarding the pros and the cons.